Thank you, Sahayani sir, and all those participants in this session. Good morning, good afternoon, and good evening. Welcome to the 1551st day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for a minute. Thank you and welcome back. Today we have with us Dr. Jessica MONTEIRO MD, Associate Professor, Department of Medicine, KLE, Homeopathy Medical College, Belgaum. Has around 14 years experience and teaching experience 12 years. Completed BHMS from AM Sheikh Homeopathy Medical College, Belgaum. Completed MD Homeopathy Philosophy from AM Sheikh Homeopathy Medical College, Belgaum. Currently pursuing fellowship in medical education FAIMER from Manipal Academy of Higher Education. Completed MSc in psychology. Completed intensive course in research methodology and biostatistics from KLE Academy of Higher Education. Completed certificate course in food and nutrition. And the topic is effective communication for patient care. How to communicate and how to perceive information. That's the most important thing as far as homeopathy is concerned. On behalf of IFPH, I welcome Dr. Jessica. You can have the platform for next 45 minutes. It's over to you. Please proceed. Yes, Dr. Jessica. Please unmute. Yes.
Can you hear me? Am I audible, sir?
Yes, of course.
Okay. Is my screen audible? Can you see my screen? Yes.
Screen is visible, but we can't see you.
Just a minute.
Okay. If any technical problem, there is no, don't worry, raise proceeding, please.
Yeah. Am I audible and
Yes.
is my screen also?
Yes.
Okay. A very good evening to all of you. I see so many prominent senior homeopaths there for the session today, and I'm overwhelmed for being given this opportunity. So I start with my session. The session today is we are going to talk about effective communication in patient care. The objectives which I have framed for today's communication topic is, although we know so much about communication, we are well versed about communication, sometimes it happens it is always good to revisit what we know. And with so many senior people here, I know this is not going to be something new that you do not know, but it is just a revisitation of what we already know. In this session, I would like to define what is communication, discuss the need of communication skills in healthcare as of today's scenario, discuss the types of communication. I'm going to have a more light shed on verbal and non-verbal communication, to discuss what are the skills we need to communicate well, what are the principles and elements of communication, the process and models of communication, and finally, we will end with what are the barriers and errors of communication. Of course, there are so many senior people around, but if I just want to know from the participants today, what is communication? I think if somebody could just share a light of what you know about communication, and how do you think what is communication in patient or healthcare today? If somebody would help me out with that. Okay. Fine. I'll go ahead about what is communication. It's basically derived from a Latin word which means communicare, which means to share or to participate. Now, it's a process of sharing the information, feelings, emotions, values between two or more individuals. Now, in healthcare, how do we define this process of communication? In healthcare, it is a process which efficiently results in a favorable change in the behavior of the parties involved or concerned. In our healthcare, it's basically the patients, a change in their behavior, or whenever we are dealing with other healthcare professionals, if there is a change in their behavior for whatever intended, what we intend to, that is called as communication. So today when I start this, I would like to bring to mind what Dr. Stephen Covey, the author of 7 Habits of Highly Effective People, underlines about communication as 2 distinct habits of leaders. Basically, leaders or communicators have very distinct habits. Firstly, they seek to understand and then to be understood. And secondly, they synergize. Now, if I want to apply this to healthcare setting, it is the communication is complete only when our patients understand what we are trying to say, or we are understanding what our patients or other healthcare professionals, our colleagues are trying to tell us. However, to make this happen, we not only need to know about what our patients are telling us, but sometimes we also need to understand ourselves. To communicate well, it's not only we should be able to listen or understand what our patients are telling us. Sometimes we need to even understand ourselves. And today I'm just trying to make a very small attempt to facilitate all of you to sometimes understand and introspect what we do during the patient interaction or interaction with other healthcare professionals. So all of you are aware what goes on during the process of communication or interaction with our patients. But we'll just go in a little detail and see what has to be done, what we are doing, and sometimes what we can do much better. So communication is a process, it's a dynamic framework that describes how the message travels between the sender and the receiver using various communication channels. Its goal is to ensure the receiver decodes the message correctly and can provide feedback with ease and speed. So whenever we are talking, we need to understand that we are sending a message across, and we are also supposed to receive the message and feedback correctly from the intended recipient. Now, according to Healthcare Professional Council, it's the responsibility of the healthcare professionals to interact effectively with patients and service users. Healthcare professionals use communication as a primary tool for gathering information in order to diagnose, counsel, rehabilitate, and build a therapeutic alliance with patients. Now, here I would like to focus our attention to saying that it's the responsibility to communicate well is the responsibility of the healthcare professionals. So when we are having an interaction with our patients, sometimes we go ahead and we say that probably the communication was not good because the recipient or our patient did not communicate well. So here it becomes our primary duty to respond, and it's our responsibility to see that the communication occurs the way it has to occur. Now, bringing our focus a little on what our master Dr. Hahnemann says, he says again in aphorism 1, the physician high and only mission. So it's our mission to cure. It's not the patient's mission to be get cured. So again, he highlights our mission that it's to cure. So when we are going ahead with in our mission, we need to carry the tools, whatever we require to accomplish that mission. And I feel communication is one tool that we need to be equipped with well when we are communicating. Again, when we go ahead ahead with aphorism 6, Dr. Hahnemann there again re-emphasizes that an unprejudiced observer, and he goes on to saying that's a very big aphorism, but I would just pinpoint certain things which I want to highlight here. There he says all perceptible signs. That means when we are interacting with the patient comes with so many perceptible signs, and we are supposed to understand those signs. So when we go ahead a little more into the types of communication, we know that it is verbal, non-verbal communication. So perceptible signs, what he is talking, we are supposed to gather all those perceptible signs. And further he says, the homeopath who grasps with requisite carefulness the whole group of symptoms further forms the totality of the symptoms. Now, here again, let us highlight the sentence, the homeopath who grasps with requisite carefulness. Then again, I want to re-emphasize here that this carefulness could be so many things, but one addition to this is a good communication skill could be that carefulness which we should be equipped with so that we do not miss on the totality of symptoms. Now, in general, when we talk about communication in today's era, it's all about selling and talking. If you look at the world of business, if you look at the world in IT, everything communication they talk about is in selling and in the business. But in medicine, the significance is altogether different. It's all about empathetic listening, connecting, and building a trust with our patients, our colleagues, and all the other people whom we come in contact with during the care of the patient. I personally call this circle as the circle of care. When we are interacting with the patients, we come with in contact with the patients, we come in contact with other colleagues of ours, we come in contact with other healthcare professionals. So we form a circle of care when we are interacting there. And when we are into the circle of care, communication is one of the important tool which is involved in primary patient care. Perhaps no other aspect in medicine has so much impact on the quality of the patient care as communication has. In fact, the heart of medical practice lies in a good patient doctor relationship, which to a larger extent depends upon how we develop this art of communication.
Excuse me, I think
Sometimes,
slides are not moving, I think.
yes,
The slides are not moving, I think.
yes.
The sixth slide is on, but
Yeah, I think yes. No. This is the slide I want to just tell it.
okay.
So when we are talking about all this communication, lack of communication leads to so many barriers. There is first of all an interpersonal relationship among healthcare professionals which is not built, which is a key factor for patient care. So when I go ahead about what is communication or why is communication important in patient care, again revisiting what I said is when we are having into patient care, we meet patients, their caregivers, their family members, our colleagues. Sometimes we discuss the case with our colleagues. We refer our patients to super specialities. Sometimes when it is an IPD patient, we have nurses, we have pharmacists who dispense the medicines, we have technicians who help us around with so many tests, x-rays, and many more people whom we interact during a single patient care. So basically this communication or effective communication benefits both the patient and the physician ultimately to get a ultimate complete satisfaction in patient care. Now, researchers have pointed out that whenever there is a good and effective communication, there is greater therapy adherence. That means patients follow our instructions well, take our medicines on time, and adhere to the therapy. Overall satisfaction of patients is good when the communication is effective. There is decrease in patients' distress and susceptibility to symptoms of anxiety. Most of us patients, when they come to this, one of the symptom which they usually come out with anxiety about their problems, anxiety about meeting the doctor. So many anxieties they come out with. And one of the important thing is when we have effective communication, this helps in decreasing the patient's anxiety. And finally, I would like to stress that effective communication strengthens the doctor-patient relationship. Now, I would like to just draw your attention to this document. This is the World Health Organization Plan of Action document, which was released in 2011. Now, this was the South East Asian Regional Office organized a consultation This consultation with so many heads of so many countries, it was in Nepal, I believe. The meeting concurred with the feeling that there has been perception in this patient-doctor relationship in the recent years. This could be seen by because there was increased litigations against doctors and the incidents about violence against doctors, unheard, which was very unheard earlier, of doctors' clinics being destroyed, and occasional reports of doctors being assaulted by attendants and relatives. Because in the recent times, we see this to be more rampant as compared to the older times. Now, why was this? There was a lot of consultation which occurred in the WHO consultation in 2011. And some of the important lacunae which were found was, it was because of the social cultural issues which are there. It is the economic issues between the patients. There are errors in the health system. And one of the important lacunae which was found was lack of communication skills within the medical fraternity. And they said 50% of the complaints against the doctors received by the medical council would have come down very drastically if the doctors had cared to talk to the patients and their attendants very promptly and in a better way. So this was what was the output of the meeting, which was done in 2011 by the WHO organization. When we go to this document, I have just put this the picture of this document. It says that the interaction between patient and doctor is like a two sides of the coin. When the patient is attending the doctor says that I have seen so many patients and now I have to get down, and this is the patient who is coming, and he is not interested because he has so many barriers. Whereas the patient says, I am waiting from so long, and the doctor even doesn't have time to look at me, to even consult, to talk to me appropriately, to even smile at me. So these are like two faces of the coin. The doctor has his own perception and own reasons why he is not able to adequately meet the patient's need, because nowadays it is the lack of time, and the patients have their own reasons why they do not feel satisfied with the interaction with the doctor. Now, the present scenario which we see in our healthcare system is there is increased availability of medical technology. So it's not only the doctors whom they are dependent on, technology is to their aid. There are options for multiple opinions, like patients do doctor shopping. If one doctor is not available, there are many more options available for them. Next is the rising expectations of patients. Patients are having excessive expectations in today's scenario. So keeping in mind the today's scenario, again, I will re-emphasize the need of effective communication in patient care. The document I just referred to, the WHO document, has listed down certain doctor-related factors and patient-related factors for non or what is required for effective communication. Many of the factors which were laid down are the qualification of the doctor, the competency, the attitudes, the ethics. But one of the important competency which was laid down was the skills, the essential skills that a doctor needs to hone, or the medical fraternity needs to hone while interacting with the patients. And the patient related factors are expectations from the doctor. They are already informed and knowledgeable about their problems. The trust factor, the literacy of the patients, and their past experience plays a lot of role during the patient-doctor interaction. The past experience could be a good experience or it could be a bad experience. Now, this patient-doctor interaction again depends upon the availability and access to medical care, communication, empathy, supportive environment, and combined decision making. Combined decision making is something that is on rise or very relevant today. Previously, it used to be the doctor used to decide for the patients and the treatment is to go ahead. But nowadays, decision making along with the patient is a very important factor in patient care. Now, when all these competencies or doctor related factors and patient related factors are well taken care of, The output is there is satisfaction in patient care, there is adherence to treatment, there is patient-centered care, and a very good trust is developed, which is built between the patient and the doctor. And the outcome is there is improved doctor-patient relationship, improved quality of healthcare. Now, when we are talking about the essential skills, I said one of the important or one of the reasons for deteriorating of patient-doctor relationship is there is lack of communication skill in the doctors or in the medical fraternity. The doctor finds difficult in talking to his patients not because he does not want to talk, but in many of the cases, he does not know how to talk. Most of us, if we just revisit our medical education days, we were not taught about how to communicate to the patient. But over the period of our years of medical experience in practice, we have learned how to communicate with the patient out of our practice. But our interns just coming out of the internship, they definitely find it difficult because they want to communicate well, but they do not know how to communicate. So one of the essential skills when we are interacting with the patients are communication skills, clinical skills, managerial skills, empathy, care, professionalism, and ethics. And communication skills in today's era is the outstanding tool for enhanced patient-doctor interaction. Now, again, when we are going ahead with a patient-doctor interaction or interview, in homeopathic interaction, it is the case taking. Now, the case taking basically has the three important processes. One is the content, that is what we are taught in our homeopathic organon about case taking. The content, the format of how to take the case, that is the case taking format, the case taking in organon, that's the content. But the second process, how do we take it? In reality, when the patient is there with us, the process of how we are asking the question is something which is very important, and it makes the patient-doctor interaction very successful. And once the process and the content is in its place, the perception either from the side of the patient or the perception from the doctor, this is something which is very important. Now, when we are talking about a homeopathic case taking, we basically want, or the whole idea of homeopathic case taking is to individualize and to find the simillimum. But in this bargain, we are also supposed to build a good rapport with the patient. Only then we are able to individualize well and find the right simillimum. And that is why most of us are not able to come to the simillimum, because one tool of communication somewhere is missing. History taking again is depending upon how effectively you are able to communicate with the patients. Now that we have seen why communication is important, what is the need of communication in today's days, I would like to throw a little light about types of communication. If you want to, of course, this is something that all of us know, but it is always good for us to revisit and just introspect of how we use the different types of communication during our patient interaction. So we talk about verbal communication, non-verbal communication, visual communication, and written communication. So non-verbal communication refers to any form of communication that is transformed or transmitted through spoken words. Non-verbal communication is a form of communication that occurs through spoken word. And visual communication means transfer of information to a person in the format that can be read or viewed. And written communication involves the use of words, sentences, and paragraphs in order to communicate. So all of us know we use all these types of communications together while we are interacting with our patients. Now, when we are talking about verbal communication, it involves the words which is either spoken through a message. And what are the characteristics of the verbal communication? It relies on the words and the language we use. Sometimes it may be the words which we are using is not appropriate, or the patient does not understand. We may use some medical jargons which the patient is not able to get along with. So this is something, or it may be some cultural barriers where our patients are talking in certain language or certain words which is not being well understood by the physician. So these could be like, the barriers, or this should be nullified when we want to have a good verbal communication. Clarity. Now, when we speak, when we are having a verbal communication, because most of us make use of verbal communication during case taking, the way and the clarity with which we express our thoughts directly is very important in context of good case taking. Our words should be well chosen and well expressed with clarity when we are talking to the patient. It's not only the words what we use, the clarity, but it is very important that the tone and the pitch of how we are talking to the patient is very important, which influences how the message is received. Sometimes if the tone or the pitch is not appropriate, the speaker would seem not very confident, or he would seem very hesitant to the patient, which again is very which makes the patient lose his trust on what the doctor is saying. He is not able to completely trust the patient because the doctor himself doesn't look to be confident in the way he is speaking through his tone or his pitch. Now, examples of verbal communication could be face-to-face conversation, talking directly to some patient, phone or video calls. Nowadays, it's an era of e-communication where we take everything through technology, where WhatsApp or some Google chat. So communicating over phone or a video chat is also a form of direct communication. Immediate feedback. So what happens in verbal communication is we are able to get a verbal or a very direct feedback immediately, which clarifies much of the misunderstandings which would rather take place while communicating. Why is it more efficient? Because it's a much quicker way of communicating, especially when we want detailed information. The verbal communication is much more better and quicker than the other forms of communication. Now, what is non-verbal communication? Non-verbal communication is the transmission of messages without the use of words. It includes facial expression, gestures, posture, and body language that often convey emotions and attitudes. It is used to reinforce verbal communication. Sometimes, if our body language or our verbal communication do not match our non-verbal communication, our messages or our words may be misinterpreted. For example, if I am talking and I am not confident, if my body language shows that I am not confident, the patient would be confused. What is the doctor saying? Because when we are using a non-verbal communication, it reinforces what I am talking. So verbal communication is reinforced by non-verbal communication. So when we use non-verbal communication, there are some characteristics, or the different characteristics of non-verbal communication is kinestics. That is, use of hand and body movements are a very important characteristic of non-verbal communication. Our vocal cues, that is the way we use our voice, the way we use our pitch, vocalics is something which is very important part of non-verbal communication. Haptics, that is the use of body contacts. Now, when we are interacting with the patient during physical examination, body contact is a very important aspect of non-verbal communication. And proxemics, that is the spatial cues. The distance between the doctor and the patient forms an important part of the non-verbal communication. So if I go into a little detail about the non-verbal communication characteristics, it is the facial expressions. These can indicate feelings such as happiness, sadness, confusion, and often reinforce or contradict verbal messages. So as a doctor or as a physician or as a patient, the feelings of happiness, sadness, confusion more are transmitted through our non-verbal communication rather than verbal communication. Gestures and body language. Movements of the body, such as hand gesture or posture, often convey important information that words may not express. For example, if I'm just folding my hands and I'm sitting, it would show that I am not interested. If I'm just leaning back and I'm just sitting, it means that I am hostile. So these body languages convey more than our words can express. If I'm just sitting, there are certain ways in which the body language plays a much larger role rather than in verbal communication. The next very important thing is eye contact. Maintaining or avoiding eye contact can signal confidence, interest, or discomfort. We should have the right amount of eye contact with the patient. We cannot stare at the patient for long. That also makes the patient uncomfortable. We even cannot avoid the contact with our patient. That makes the patient feel that we are disinterested in them and it makes them discomforted. Our eye movements reveal exactly what is going on in our mind. So, eye contact with the patient increases the physician's credibility. When we are talking to the patient with a good eye contact, that helps the patient know that our level of confidence and our credibility is much more higher. Now, proxemics. Now, this refers to the physical distance between communicators, which can indicate the levels of intimacy or formality. Now, there are 4 levels of distance, physical distance, which is normally indicated. When it is just less than 2 feet, it is an intimate space. So the patient would never want the physician or anybody else to intrude into their intimate space. 2 to 4 feet is something which we call it as a personal space. So social space is around 4 to 8 feet and public space is around 8 feet along. So a good patient-doctor interaction is said to be good when the distance between the patient and the physician is around 18 inches. So this is called to be a normal and a good distance between the patient and the doctor, which emphasizes good proxemics. They show confidence and this helps the patient develop more. So this is this is how proxemics is very important when we are interacting with the patient, especially when we are doing physical examination. It's very important that we keep in mind all these important characteristics of non-verbal communication, which helps us to reinforce and build about and strengthen the patient-doctor relationship. Next very important aspect of non-verbal communication is the body posture. Now, it is an effective means of non-verbal communication. For example, if I am sitting with hunched shoulders, face supported by our hands or elbows, this definitely shows the patient that we are disinterested. The same thing where whatever I'm talking about the body language, when we know about ourselves and the patient is also doing the same thing, we are able to get so many cues from the patient, because ultimately it's not only the subjective symptoms which form the totality of the patient, it is also the objective symptoms. And when we are able to understand and appropriately follow all these verbal, non-verbal communication, it becomes very easy for us to pick up those objective symptoms which the patient is signaling to us through their body language. Now, whenever we are leaning too far, that shows that we are hostile. This is the concepts of body language which are scientifically proven. So hostility is when we are leaning too far away from the patient. When their feet are too far, that means we are ready to attack, or the patient is ready to attack. It is a body language which shows there is an error which says ready to attach, but actually it is ready to attack. Feet too close again indicates there is nervousness or there is non-comfortable between the recipient and the either the recipient or the sender. So feet too close indicates that there is nervousness. Folded hands against chest. Now when we fold our hands against the chest, it indicates resistance. So the patient is able to cue this resistance whenever we almost all the non-verbal communication which occurs are non-intentional, but they just express and indicate what exactly is going on in our mind. Juggling with fingers or nails again indicates not interested. Now, when the patient is there, when the physician or the other people around the healthcare professional, if they are juggling with their nails or with their phone, that directly indicates to the patient that we are not interested. I recently, since I am doing my fellowship in medical education, I am working on a project which is again about effective communication in patients. And for that, I had to interview a couple of patients. So few of them, I actually interviewed around 30 patients, and more than 50% of the patients had this problem, saying that whenever we enter the consultation room, it's always better that the doctor is not with the mobile or their assistants. Most of the time, we are using our mobile for repertorization, or we are using the laptop for repertorization. But the patients are not aware that we do it because it's our requirement. And that was re-emphasized by most of the patients whom I interacted with in the focus group discussion, saying that if when we are talking to them, if they at least can look at us, this is makes us more comfortable rather than them looking at the computer. I know it's a very important part for us to repertorize this, but maybe we can just do it in a much better way. We can tell our students not to always look at the mobile or juggle with the mobile, because that is sending a wrong cue towards our patients. And most of my patients whom I interacted had this problem when I was interacting about what is that they like or do not like about the case taking part. Tapping the toes. When we are tapping the toes unintentionally, that means now we are ready to get out. We want to go out. Especially this happens when we are in the clinic at the late hours, whenever it is time for food or whenever it is late night in the evening, tapping our feet. That means now we want to go, but there is a patient who is going on telling his problems. So this unintentional shows that we want to go, but you are telling us and you are holding us. So these are the body postures which play an important role or give us important cues about how we need to interact with our patient. Again, different from touch is again a very important non-verbal cue. Touch may have different forms and meaning. It is used to convey emotions like affection, sympathy, and familiarity. Now, this becomes very important when we are dealing with pediatric patient groups, because in these patient group, a pat on the back or just like moving your hand around their back gives them a sense of security. In pediatric patients, and we are supposed to know how much pressure to put and how to examine them, because that again gives them a lot of it helps them to continue, or it gives them that kind of sense of security during the patient doctor interaction. And whenever we are examining the patient, something which we need to really take care of is the cultural background of the patient, because not all patients are okay with the doctor examining them. So this again is a part of the ethical or ethics during physical examination. But again, to re-emphasize, touch is a very important non-verbal characteristic which we need to always remember. Again, very very important. I know from the time of our medical studies we have been always been emphasized on this, but again it is good to revisit this important point. The choice of dress, the appearance of the doctors are something which we really need to take care of. The color of the clothing, the hairstyle, and the personal appearance is considered an important tool of non-verbal communication. Appearance can alter the physiological reaction, judgment, and interpretation. The minute the patient enters, the first thing he tries to see is the appearance of the patient. And I'm very sure most of us have, all these senior people around would know that the judgment and interpretation to a larger extent depends upon how we appear to the patient. So that's a very important non-verbal cue or characteristic which we need to understand and remind ourselves when we are interacting with the patient. Now, there are some important skills that we need to understand in communication. There are two types of skills. One is the sequential skill and one is the longitudinal skill. Now, what is a sequential skill? Which, while interacting with the patient, we use this in sequence. So, when we are initiating the information, we need to have some important skills. When we are gathering information, again, we have to have some important skills and the closure. So this is how we sequentially interact with the patient. And there is something called as longitudinal skills. Those are the skills which we need to hone ourselves all throughout the patient-doctor interaction. So let me just throw a little light about what are the initiating skill or the sequential skill. So as soon as we interact with the patient or the patient comes into our clinic, the initiating information, the way we receive the patient or the way the patient enters the clinic is something which we need to again emphasize on. So attention to the environment is something which is very important. If the environment is really not okay with the patient may not feel very comfortable. Especially the patients in today's this are really very particular about this. Mental preparation. For example, we are repertorizing a different case. Leaving that case and then welcoming the patient is a very important part of initiating the information during the patient-doctor interaction. Introducing the patient, just saying good morning, good afternoon, or just welcoming by a verbal cue, just showing hand is something which helps us to initiate a correct information. Building rapport, just by saying how are you, what is your name. These are small things by verbal and our non-verbal communication, how we build rapport. Effective opening question. Now we have to interact with the patient. So most of us in our case taking have taught always address the patient by name. So some opening questions are really very important when we start interacting with the patient. How are you feeling today? Rather than what happened? If we just go on asking, this opening question is very, very important for us to initiate information and developing the agenda to guide the conversation, that we know that we have a good case taking format. Now, gathering information, that's the second part or very important part of the sequential skill, that is effective listening. Now, when the patient is settled down and he started with his symptoms, effective listening, not only listening, but effective or active listening is something which is very important. And I'm sure most of us homeopaths know the importance of active listening, because most of our remedies are here which the simillimum is told by the patient. When we actively listen, we are able to pick up those important cues of the remedy if we are in a mode of active listening. If we are just listening, we are definitely, we most of the time lose that space where we miss the simillimum in the patient. Effective questioning, how we put the questions in front of the patient is also a very important sequential skill. Internal summaries. Now, when the patient is talking, we need to summarize. That is something very important, that helps us to build the totality of our symptoms. Summarizing and checking. Like Dr. Hanneman says, every time a part of the case taking is done, summarizing and checking if my case is complete is something which is very important part of my sequential skill. Evaluating the patient's perspectives, what the patient is trying to say, the ideas about the patient, why is he saying that, the emotions with which the patient is talking a certain, or the emotions with which he is coming, the concerns the patient is having, his past experiences, and ultimately the expectation. So IECEE is something which we really need to importantly evaluate while we are interacting with the patient. Evaluating patient's information and giving information. This is very important part of our communication. Rather than this, we need to give information aptly to the patient. Again, when I was talking to a few of the patients were very much concerned. Why do homeopaths ask, do I like cold water? Do I like hot water? Do I like cold weather? Do I like whether I like hot weather? So there are some patients who do not understand, especially the literate part or the literate group of people. They had this because the patients whom I was interacting, most of them were from in this age group of 35 to 45, and they were the literate group of patients. So they were saying, doctor, when somebody is asking us, why do you like cold, or why do you like sweets, why do not like sweets, I do not understand why they are asking. If we are given an information why this is important during case taking, probably it helps us to give the right answer, or it helps us to understand why the doctor is asking. Otherwise, we just brush away the question and we do not pay importance to that. So, giving the right information to the patient as to why we are asking them those questions is an important part of interacting with the patient and effectively communicating with the patient. Not only initiating the information or gathering the information is very important, but closing the information is very important. For us, it's like, whether the patient has understood our follow-ups, or the way we have to take the medicine, how he has to come back for follow-up, chunking the information, because we do not have the medicines which we prescribe, they are so different. Some have like, LM potencies we give, we have to, like, take water doses. So sometimes giving the information, providing the summaries, giving them details about your availability, when you are available, how can he contact you the next time, collaborative planning. When we are planning about the medications of the patient, always one important aspect which is on rise today is decision making. So if you want to send them for a particular test, or if you want them to plan something, a diet plan or whatever, collaborative planning is very important when we close our patient doctor interaction. So this is a very important part of the sequential skills that we need to understand. Now there are something called as longitudinal skills. Now what is this longitudinal skills? These are the skills which help us to build a relationship. Now, for example, greeting the patient all throughout the interaction with the patient, greeting the patient, smiling, I mean, like, giving a proper, appropriate body language, respect and care to the patient. Most of the patients, of course, most of us, 90% of us make some arrangements for the patients to sit down. But so many times it happens in a busy OPD, we just have one particular chair and we do not even ask the patient's caretaker to even have a seat. The respect and care is something which is very important, that has to be taken care of. Body language, the way you sit, or the way in which the sitting arrangement is made, is something very important. Eye contact, active listening, asking open-ended question, giving explanation for your probing and clarification, empathy and sharing thoughts. So these are some very important aspects that go a long way in building a good therapeutic relationship or a patient-doctor relationship. Now, when I'm talking about active listening, what is active listening? Active listening is when you are available to the patient, you not only hear, you listen to the patient and you are attuned to their thoughts and feeling. It turns a conversation into active, non-competitive and a two-way interaction. So in active listening, we have three important components, that is cognitive, emotional and behavior. So William Osler, who is called as the father of modern medicine, he said, listen to your patient. He's already telling you the diagnosis. So when you are actively listening to the patient, you are almost there with the simillimum, you are almost there with the totality of the patient, and you are almost there with the diagnosis, because the patient is already telling you all this. So this active listening is a combination of your cognitive domain, your emotional domain, and the way you behave with the patient. Now, there are 6 levels of listening. We know that when we sit in the front of the patient, it is not that always we listen. 6 levels of listening is either we can ignore what the patient is saying and pretend to be listening to the patient. That is one of the things when most of our in some busy days, that could be one of the option where you are busy with something else, or you're preoccupied, or there is a psychological barrier and you are just pretending to listen. There is selective listening. You want to listen only what you want to listen, not what the patient is saying. So selective listening is one of the important barriers which do not get us to the right simile, because we listen only bits and parts of what we want to listen. Attentive listening is something which we are supposed to do. Attentive listening is both our cognition, our emotion, everything is in equilibrium. Reflective listening is a step higher to normal listening. When I am reflecting and seeing what my patient is saying and why he is saying so, is something which is very important for us. Empathetic listening is a cherry on the cake. When I'm empathizing with the patient, I'm able to understand. So types of questions are opening questions. It's a very important indication to how I can start the interaction. Screening questions, clarifying questions, probing questions, verification questions. Now, clarifying questions is you do not understand something, you please clarify with the patient and ask, I do not understand this, please can you say this? So these are the questions which are clarifying what your patient is saying. Closed-ended questions is especially when we are dealing with sensitive issues, when we are taking the sexual history or when we are taking the mental history, maybe a close-ended question is something which is more appropriate. Leading questions is, according to Dr. Hanneman, when there is one-sided interaction or case taking, leading questions are something which can be again asked. Now, once we finish asking, there are types of responses. Either you can respond by silence. Sometimes during the patient-doctor interaction, silence is required. It helps the patient to think. But silence for too long is not something which is good. It has to be an appropriate silence which gives the patient a pause. Empathizing. Again, when you are talking to the patient, empathizing. For example, the patient is in distress. Empathizing, I understand what you are going through, is something which gets a long way towards patient-doctor interaction. Facilitating the patients to answer is again a very important type of response. Paraphrasing. Paraphrasing is something like is a very important non-verbal cue. If the patient says doctor, I am not feeling good, you have to respond it by certain paraphrase. Oh, I know it is very cold outside, or I know it has been a tiring day for you. So paraphrasing is something which is very important part of a verbal communication. Restatement. Restatement is repeating what the patient is saying to emphasize some important points during your interaction with the patient. It may be their therapeutic questions you are answering, or it is something related to the part of case taking. So restating what the patient tells them, it re-emphasizes the importance of that particular statement the patient is talking about. Again, active listening, we can remember this active listening by this acronym SOLAR. SOLAR is sitting face to the speaker in a squared position. Whenever you are active, you want to, or there is active listening to be done, it is always recommended that you sit in a position that is squarely to the patient. That is S. O is open posture with arms and legs uncrossed. And if there is some barrier, it has to be open. There has to be no barrier between you and the patient. So it is an open posture. L is lean slightly towards the speaker to show interest and engagement. So when you lean towards a little towards the patient is something which indicates active listening. Eye contact. Maintain it to signal focus and attentiveness. So maintaining a good eye contact is again a very important part of active listening. Relax and avoid distracting. So when the doctor himself or the physician is in a relaxing position, probably that again indicates that he is actively listening. So SOLAR is an acronym which we use for active listening. that is sitting face to face in a square position, open posture, no barrier between the doctor and the patient, lean slightly towards the speaker to show interest, maintain eye contact, and relax and avoid distraction.
Excuse me, doctor, you have only 5 minutes remaining.
Yes. So these are the important things which we need to understand in patient-doctor interaction. I think there are few more slides, but yes, I would directly go to the last slide about barriers of communication. Why there are barriers in communication? One is there is a physical barrier. Maybe you are not available, or the environment causes some physical barrier like time, place, space. Barriers caused by the wrong choice of medium. Normally, if you have to talk to the patient verbally and you are using a written communication, probably that is something which is a barrier for communication. Semantics, using wrong words, is another barrier for communication. Cultural barrier, when the cultural between the patient and the physician do not match, or they do not understand each other's culture. That is an important barrier. A psychological barrier. The psychological barriers is the psychology of the patient, maybe the mood, the attitude, whatever the patient, physician has or the patient has could be a psychological barrier. And barriers caused by varying perception of reality. Maybe I said the barrier could be just an appearance of the patient or the doctor doesn't go well, it is the wrong body language. So these are the different types of barriers which the patient, or which lead to decreased or non-effective communication. So take home message, what is something which we need to take home today is communication is the art of exchanging information between people and the means of connecting to them. And this is a very, very important aspect of our case taking. Good communication are the keys to success. Effective communication is the physician's most powerful tool to improve patient care. And finally, I would like to emphasize, if knowledge of medicine, surgical skill, and clinical acumen is the craft of medical practice, then communication skills are the fine arts of practice. So this is something which we really need to take home. And if I have 2 more minutes, I would just like to go through the slides. This is a research project I am working on. And this research project, where I have done a qualitative analysis and a quantitative analysis on communication skill. So 200 of the homeopathic consultants and students were asked to take a survey and asked what are the important barriers in patient doctor interaction. So most of them said lack of communication skill, lack of sensitivity to patient and cultural background, and not able to communicate in patient's language. Whereas the other important things where we need improvement while communicating with the patient was active listening, building trust, empathy, explaining treatment options, and non-verbal communication. And when I did a qualitative analysis of the same thing, body language which came out to be the outstanding. Most of the patients felt that body language is very important. So what I want to re-emphasize here is, we as physicians feel that non-verbal communication we know, and it's important but not very important. But look at what our patients want. They feel that body language is something that we need to take care of us. Complete information is something that we need to give to our patients, and listening actively and with awareness is something what the patient wants from us. Okay. So what you see, this is disparity in what we know and what our patient wants. Yes. And that can be overcome by understanding what is effective communication. So yes. I hope I have done justice to what I'm supposed to do. Yes, and thank you for giving this opportunity.
I did communicate to you that the 45 minutes is the duration of our session, and we need, in fact, 15 minutes of discussion. But unfortunately, that wasn't happen. You must have listened to that. Let me come to the solution. So we welcome Dr. Sergey to express sort of thanks. Dr. Sergey, please. Dr. Sergey, are you there? Yes, please. Unmute. Dr. Sergey.
Yes, I am here.
Yes, please.
Thank you, Dr. Manoj. And it's a wonderful session, very excellent. I'm I know that the interaction between the patient and the doctor is very important. Most problems are solution about good interpretation. Thank you so much, and thank you IFPH for you give for a chance a lot of good the doctors and like good presentation. Thank you so much, Jessica.
Dr. Sergey from Turkey. Anyways, nice person because you have for the fellowship in medical education. This indicates that each and every medical persons or students should follow all these things. Very wonderful person. I think our National Council Homeopathy must also consider this an integral part for the
Very important, sir.
Yes.
Now, the Medical Council of India, they have started the ATCOM
Yes.
model for MBBS students where they are
Yes.
teaching them
Yeah.
communication skills.
Already
And I believe the new NCHs come out with a communication module, but we as homeopaths need to percolate it towards our interns and students, because most of our senior physicians, they have learned with experience, but we cannot leave our students without training them. And I think this is something and the need of the hour, sir.
We are very specific for maintaining time. So, sorry, Dr. Jessica.
Yeah.
Let me conclude today's English edition. Hope you then back again tomorrow. Till then, goodbye. And Dr. Mariama John to continue the program. Malayalam.
Thank you, sir. Thank you. Bye.